Hello and welcome today to Experience ISU, specifically radiographic science. We have lots of things to show you today. My name is Wendy and I'll be your host, and this is Mr. Bones. As you can see in this department, we like to have a little fun. We're so glad that you joined in today. Here's my contact information. I'm the clinical assistant professor and clinical coordinator of the radiographic science program. Next, we have a word from our program chairperson.
My name is Christopher Wirtz, and I'm the program director for radiographic science. I love this field so much, and I had such great mentors here at ISU when I went through the program that I wanted to come back here and teach. So that's what made me want to move into education from just being a radiographer. Radiographic science is the study of medical imaging. Students in my program learn how to acquire diagnostic medical images by taking x-rays. One of the things that sets our program apart is the bachelor's degree, in that most programs in the nation only offer an associate's degree as entry level. Our students have a bachelor's degree when they graduate, and therefore it's easier for them to go on and specialize in the other modalities like CT, MRI, ultrasound, nuclear medicine, radiation therapy. And it also sets them up for leadership and management positions later. Our program incorporates the schoolwork with the clinical education. So one day a student will learn about an X-ray physics principle, and then they'll go out to the clinical setting the next day and work with radiographers in a clinical setting with real patients. Other programs will be sit in class for a year, learning all of your stuff, and then the next year you go out and do all the clinical stuff. The integrated model really helps students put that stuff that they're learning in the classroom to work. So day one when they graduate, they're ready to step right into a job. Right now there's a national shortage of trained radiographers. I get requests all the time from people in the local area saying, hey, would you send this job opportunity out to your students or out to your graduates because we need somebody. There's a lot of other options, but people come here, and we've had people come to our program because of the reputation that we have. We've had people come from California and Washington and all over to come to ISU for this program. If they've chosen to come to ISU, I say you've chosen well.
And you've chosen well by being part of Experience ISU with Radiographic Science today. We're going to try to show you, even though over Zoom, you can't have a tour of our rooms in person, but we do want to show you as much as possible. Here we have a student, as Chris was talking, we integrate what we talk about in classes. We then will lecture. For instance, here you can see one of our students taking a skull x-ray. This is one of our x-ray phantoms, that bone that's encased in plexiglass. We'll talk about skull x-rays in class. Later that week, we'll break down into small groups for lab. So they learn the classroom didactic portion. We'll break down into the smaller groups. They'll take the x-rays on the phantoms, and then during the course of that same week, they'll be out at their clinical site doing the x-rays they've just learned about as well. Here again is examples of our students down here in our classroom and laboratory. Typically in a class, we have 21 students in both the third and fourth year, so 42 students total. Again, we'll have them together collectively for lectures, and then we break down into groups of 5 or 6 for hands-on positioning labs. Here's a look at our brochure, if you have not seen it yet, on the Radiographic Science website. Again, it has all of our contact information of all of the program faculty. Again, Christopher Wirtz, the program director, myself, and Trevor Ward, our other assistant professor here. It also has Chelsea Wheatley's contact information for those interested in sonography. And it also has financial aid office and admissions office. So this is on our website, and I have the link for that at the end of this PowerPoint as well. In this brochure, it shows you the classes that we take as prerequisite classes. The first 2 years are basically your gen eds, your biology, your anatomy and physiology, your physics. At the time that those courses are complete or almost completed, We ask that you speak to us for advising at the time it gets close for you to fill out your application, as we're happy to help you with that so that you're successful. And again, these next 2 years, professional year 1 and year 2, would be once you're accepted into the radiographic science program. So the classes that you'd be taking then, including a summer semester. So the X-ray portion is 5 semesters long. As we just stated, on-campus and clinical rotations for the 5 semesters that you'd be here. You'll do procedures in diagnostic radiology, and you'll learn basics of computed tomography or CT. You'll also take an online CT course during the summer between professional year 1 and year 2. You'll be awarded a Bachelor of Science degree in radiographic science. Following graduation, you will take a national exam proctored through the ARRT, the American Registry of Radiologic Technologists. And upon successful passing of that, you'll become a registered radiologic technologist. And following graduation, one of the benefits of our program is that it provides the basis for all medical imaging. You'll have the opportunity to cross-train into other modalities such as CT, MRI, DEXA, mammography, interventional radiography, and you can even apply to join our sonography program. So there's lots of opportunities down the road. Terms used to describe us: we're registered radiologic technologists. You can also call us a rad tech or a radiographer. Please don't call us a technician. That's a term from days many past that have gone by. That's more for just the on-the-job type training. Today's technologists have degrees, so technician is not a term that we use. Chris likes to say technicians change your oil at Jiffy Lube. They don't take your x-rays. And the other term that we're not is we're not radiologists. Radiologists are the doctors that read and diagnose our x-rays or medical imaging exams. Again, we're the ones that take the x-rays. Typically nationwide, the degrees that are offered are an associate degree or a bachelor degree. Again, here at ISU, we offer a bachelor degree, so another prime reason for why you want to come here. Our graduates, after graduating from this program, they lead facilities. They are department managers. That bachelor degree sets them apart. The classes that distinguish our degree are healthcare administration, human resources, and accounting. They will help you manage and run facilities. We are a very important part of the healthcare team. And like I stated before, it's not just x-ray anymore. For instance, if you go to work at Madison Memorial, even following graduation, they like their staff that they hire to be at least dual modality, meaning that they do x-ray and CT, that they offer more than one service. Again, you have opportunities for that with CT, MRI, ultrasound, nuke med, radiation therapy, and mammography. So if you like technology, this is definitely a field for you. We are always getting new equipment and upgrades to our software packages, so it's always continually changing. We're always enhancing our body of knowledge. I'm often asked what a normal day is like, and there really isn't typically a normal day. For instance, all it takes is one snowstorm or one slick day to make things pretty crazy in a medical imaging department. We can go from feast or famine. In the imaging department, we do outpatient exams like a routine chest x-ray or barium studies. We can go down to our NICUs, our intensive care units, and do portable x-rays. We go to the emergency room to do x-rays. Emergency room patients come to our department for x-rays. We go to the surgery department to provide C-arm services and image as they're doing surgical cases. So we are really busy in a hospital, and we typically go to all floors. And for me, that was one of the things that drew me most to this field. Was it's exciting and every day is a little bit different. So truly there's no normal day. It just depends on your caseload for the day. Here's an example of technologists taking an x-ray of the tibia and fibula, so the lower leg. You can see that they're positioning the patient on the plate. Cool thing is, again, going back to the technology, we take the x-ray and within a few seconds, this x-ray comes up on our workstation and we're able to look at that before sending it to the radiologist for interpretation. Here's a technologist, again, going to the patient's bedside. So we have x-ray machines on wheels. This is a portable x-ray unit. Again, they're going to the bedside. They'll take a chest x-ray. You can see, in fact, right there on that computer display, they've taken a portable chest on that patient. And again, back to, we're not the radiologist. We send our x-rays to the radiologist for interpretation. They're the ones that read our x-rays. And again, they go to medical school and about 10 plus years of college. So here's a radiologist. Again, we're active with them in our department in performing procedures, biopsies, having them read our x-rays, especially stat reads. Here's a radiologist sitting there, again, looking at his workstation. Here he's reading CT, and he'll provide that diagnosis and interpretation for the physician or healthcare provider. For us, providing a diagnosis and reading the x-rays is out of our scope of practice. So that's not something that we do. The job outlook for radiographic science students is great. In fact, most of our students are hired before they graduate. In this program, it really is like a 2-year job interview, and clinical sites will pick the students that have come to work every day on time, that have a good attitude, that have a good work ethic. And they'll hire those students as an x-ray intern before they graduate. Or there's also several small clinics around that also hire our students. So most of our students, if they're looking for a job, they'll have one before they even graduate from ISU. And according to the US Bureau of Labor Statistics, employment for radiologic technologists is projected to grow 7% in the next 10 years. And that's faster than the average for all occupations. Same thing for MRI technologists. So we are above the national average. Median pay is $60,000-ish. Again, in Idaho, it might be slightly lower just due to the cost of living. But again, that's annual data from US Bureau of Labor Statistics. I threw in sonography since we also have a sonography program here. And again, with that same information, for sonographers, that's even higher. In fact, for sonographers, their growth rate is 12% over the next 10 years, so much faster than the national average for all occupations. And again, this is largely due to baby boom population, need to diagnose medical conditions such as blood clots and heart disease. Other thing with sonography is it does not use radiation, so doctors and healthcare providers are always looking for ways to reduce patients' exposure, and sonography is the go-to for that. Anytime we can send them there, that's best for the patient. So they do that. So sonography is even much higher than rad techs. Right now, currently, median pay $33 an hour for sonographers, or almost $69,000 annually. And again, there's that information with the link that you can go to look up more on that. So job outlook is great. You can have a job anywhere in Idaho or beyond. Again, we take that national test. You can go to small cities and work, you know, Arco, Driggs, they have hospitals or healthcare providers there that need x-ray services. So you can go to small cities and stay rural to practice, or you can go to the biggest cities and run those departments. We've had several go to Primary Children's, to Denver, to Seattle. And again, within a short amount of time, they're not only the lead technologists there, they're often the managers or directors running that department. Just a little bit of history for especially those in high school that may not know. With x-rays, they were discovered in November 8th, 1895 by Wilhelm Röntgen. He did not know what he had found. He found rays, but he called them X for unknown. One of the first images that was taken was of his wife's hand. And you can see her hand there again with her ring on. And comparing that to today's x-rays, there's quite a bit of difference. And x-ray systems, again, here's a look at several of the x-ray machines that we have today. This is the CareStream package and products that they have. Their DRX Revolution is one of the little portables. Many of our clinical sites here in Southeast Idaho have that. We call it the little Ferrari. It's got all the bells and whistles. Again, makes patient care much better. There's other types of portables. They can retrofit older portables. Okay, DR Evolution X-ray room. Again, we can take X-rays and within a matter of seconds, these images are transmitted to a workstation. And the beauty of that is healthcare providers can get on and access that once the radiologists have dictated a report. And not even just local healthcare providers. Providers that are nationwide or even worldwide, if they have access to your system and have privileges for that. Okay, we can get them instantaneous results. And again, that results to better patient care and diagnosis. So we do use X radiation. We have to be careful with our work practices. So what do we do in our field? We wear lead aprons for procedures that we're in, whether they be surgery cases. In this first image here, you see technologists. This is a C-arm, and they have it draped. This provides fluoroscopy to the surgeon. If you look here on this monitor, they're actually doing pinning and plating. Typically, this occurs on fractures. And again, technologist is going to wear their lead apron while in the room to reduce their occupational exposure and to be safe during these procedures. So fractures are our specialty. We diagnose obviously a lot of broken bones and other pathological conditions. Okay, here you see a fracture. Again, we take the x-rays, radiologists diagnose them. Next would be a post-reduction. Patient goes and has that fractured reduced, okay, or put back together so that it will heal. Fracture or extremity is then splinted or casted. We'll then take a post-reduction x-ray, which you can see here. We want to make sure that the alignment is correct of the bone when it heals. We see a lot of dislocations. So the bones themselves are not broken, but joints are dislocated. There you can see on the end of the thumb there. You can see foreign bodies typically. Again, here's one in the hand. This was a nail gun accident. Okay, here we have a couple views of the hand. Good thing for this patient is this was soft tissue, so even though they were impaled by this nail, we can see that it's not in the bone itself by doing more than one view. Okay, we wouldn't have known that from just doing the first view. So that's good for the patient. They'll still have to have it removed, get a tetanus shot, and probably be on antibiotics, but none of the bones were impaled or broken from that nail. We do a lot of chest x-rays. It's bread and butter of medical imaging departments, both in-house or portable exams up on the floor. Here you see a patient and we see a pacemaker that's implanted. Again, doctors are going to get a good look at their lungs, lung volume, see if they have any infiltrates or pneumonias. We do a lot of x-rays for joint replacements because, again, our population is aging. We're wearing our joints out as we live to 60 to 70 to 80. Here on the first image, you can see a hip prosthesis, again, a total hip. Compare the prosthetic to the normal side. Okay, here we have the femur and the acetabulum, the hip, versus prosthetic hip. Here we see bilateral knee replacements, and you can see that they've used two different orthopedic appliances on the left and the right side on the same patient. Here again is look at more CTs. Our patients often go to CT after they have x-rays. And again, our students will get an introduction to CT. So here's the CT machine, the gantry, and again, a look at the diagnostic images from CT. So CT really correlates closely with X-ray. Looking at MRI, magnetic resonance imaging, and again, some of the images that they get. Excellent soft tissue views or diagnosing brain tumors, strokes, slipped discs in your back, many other things. Sonography, again, we already talked briefly about ultrasound, and it's not just babies. When typically some students think of sonography, they just think babies, but they do hearts, they do gallbladders, they do vascular structures, they even do musculoskeletal imaging with sonography. Here's nuclear medicine. Patients injected with a radioactive tracer, and then they're the emitter, and that's picked up with a gamma camera. Again, getting the more functional side. And radiation therapy, typically used for cancer treatment. So that's an option for you following graduation as well. So pros of this field, the pay is good, especially the more diverse you are with your training and skills. We typically have flexible schedules. You can work full-time, you can work part-time, okay? You can work day shift or night shift, whatever shift you like. I worked 7 on, 7 off, and I loved it because 6 months out of the year I was off. You can work in a clinic, an imaging center, or a hospital setting. So there's lots of different areas of employment. Again, the technology and the equipment are amazing. It's fun to learn. It's fun to use. Cross-training in other modalities. Most of our facilities allow you to grow as a technologist and cross-train. Also, there's other employment opportunities. You could work for a college teaching X-ray classes like we do here. You could work for a vendor selling X-ray equipment. You could be a lecturer or a subject matter expert. You can be an application specialist, going to facilities when they do new installations and teaching them. You're a super user, teaching them how to use it. You could be a PACS or computer specialist, or you could be a travel tech, meaning the X-ray techs are hired at different facilities, okay, nationwide or even worldwide when there's staffing shortages. For instance, you could pick up a 12-week travel tech position, say like in Alaska or Hawaii, and that would be pretty great. It's rewarding. There's lots of personal satisfaction. You can be a voice for your patients, for those that don't have one. By doing a good job, okay, our images provide diagnoses. If you like anatomy, we have a lot of disarticulated bones. So instead of just looking at things in textbooks, okay, in labs, we break it down even further. We have a lot of simulated phantoms, okay, again, that we take x-rays on. So coming out of the textbook, this is really a hands-on field. There's another phantom. Again, there's a knee. So we have a lot of resources for you guys. Experts become experts by going through this program and experiencing all of this. Okay, there are some downsides I will just mention. Healthcare is needed all the time, 24/7. So if you're staffed at a hospital, there will be graveyard shifts and call. And while it may be a downside, I have to also tell you it's an upside, because the graveyard shifts and call contribute significantly to our paychecks. We get typically higher rates of pay for those undesirable shifts. So while there is staffing needed, truly it can benefit you financially. So while I list it as a drawback, it can be a benefit to you. Healthcare in all healthcare fields can be stressful, okay, depending on the patient that you get. If you're in a surgery case or if you have a motor vehicle accident, we have to be cool, calm, efficient, professional at all times, so we can work in stressful environments. We have patients that are angry, confused, stressed out, or sick. So all of our patients aren't happy or cooperative. Not everyone gets better, or is their disease always cured? And sometimes, sadly, we do see death. Technologists also are exposed to more radiation than the general public. But again, we have practices that we use: time, distance, and shielding to keep us safe. We wear radiation badges. We have annual exposure limits that are monitored so that we can fall within those parameters to keep ourselves safe. And just to note, as with other healthcare professions, there are times that we may have to clean up blood, vomit, or other bodily fluids. Just to note, though, that we do wear proper PPE, so we are protected. But if you're going into this not to see blood or vomit, just note that sometimes we do. Not as much as nurses, but we are responsible for taking care of our patients as well. So what can you do now to prepare? Take your science classes: biology, anatomy and physiology, chemistry, physics. Take anything that you can that would give you dual enrolled credits. So medical terminology, introduction to allied health, or even introduction to radiographic science. We'd love to have you in our class as well. You need good grades, not just for radiographic science, but all health professions. Work on your communication skills. You have to work with people that are really different from you. You might not hang out with them after work, but when you clock in, you have to work with a very diverse group of people. And again, in different and stressful situations, so we're part of a team. Any type of experience that you can get, whether it be CNA, any healthcare related experience, volunteerism, that's always helpful just to give you a start. Make an appointment with a college advisor. Here, one of our general advisors, or here with radiographic science faculty. We're here to help you. The future truly is up to you with where you want to go. So what classes do we recommend that you take during your first semester at ISU? We're always going to start out with your Biology 1101. And the reason for that is so that you can get into anatomy and physiology later. Then we'd recommend that you take your English and math classes based upon your college placement test scores. Medical terminology would be what I'd recommend next if you haven't already taken it, and RS 105. Those collectively typically would equal about 12 credits, which is full time. Now, first semester starting out, that's a full load and you want to do well and get good grades in all your classes. If you're on ISU's tuition lock program, you would need 15 credits to keep that. So then we would suggest to add one additional 3-credit general education requirement. It can be an objective 4, an objective 6, or an objective 9. And if you guys look on that list of gen eds, you can choose any one that most interests you. And again, if you have any questions, just ask us if we have recommendations for you on what to take. So that'd be what we'd recommend for your first semester. At this point, feel free to contact us. I'll provide this information for you. Again, the links that we have, our contact information, our program brochure. We'd be happy to advise you directly if you want to call Radiographic Science at 208-282-4042 to get an appointment set up. I recommend you go through the ISU admissions process. Have your high school transcript sent up. We look forward to seeing you here at ISU, okay, hopefully on campus, okay, in the classes and in the department and in our program when you get in. I'd like to thank you for joining us today. And at this time, what I'd like to do is answer any questions that you have. Thank you.